Although depression is an incredibly common disease suffered by 10 to 20% of people during their lifetimes, it's also one of the most poorly treated, as we learned at Massachusetts General Hospital, a center of excellence in psychiatry.
Only 1 in 4 patients with depression in the community receives adequate treatment.
Depression is also striking much earlier, in the mid to late 20s instead of the 30s. Getting appropriate treatment isn't easy. Let's look at some of the obstacles. Stigma, such as guilt, shame, or embarrassment. People feel that they should tough it out. They don't recognize depression as the problem. It's not part of a routine checkup. For the medically ill, depression is often viewed as expected. And asking for help means admitting defeat.
This is a medical condition and not a fault or a weakness.
Start by finding the right psychiatrist.
When you're looking for a psychiatrist, the first thing you can do is to look for centers of excellence in your area.
Finding the right antidepressants takes expertise, sometimes from an expert called a psychopharmacologist, and patience.
It is a trial and error kind of type of treatment where you try something, you see if the patient tolerates it and responds to it, and if not, you try something else.
Antidepressants by themselves have only a modest outcome, leading to remission in less than half of cases. What works best is a combination of medication and psychotherapy.
Now, if you add cognitive therapy or other forms of therapy that are shown to be effective in depression, and you combine that with antidepressants, you're clearly enhancing your chances of success.
Cognitive therapy changes the way you think, almost like changing the circuits in your brain. But there are also ineffective treatments. For instance, a doctor might prescribe an anti-anxiety drug which won't work for depression, or people take over-the-counter medications that haven't been proven effective. And reduce alcohol consumption as much as possible.
If you're drinking moderately, a study from John Worthington in our group has shown that even moderate drinking can diminish the efficacy of antidepressants.
If medications don't work, consider more aggressive treatment.
Electroconvulsive therapy, or ECT, is a very effective treatment of depression and still used, particularly in centers of excellence. It's used often for resistant depression or severe depression or psychotic depression, and the success rate is usually very high.
And be aware that depression can be a fatal illness.
There is clearly an increased risk of suicide if you suffer from depression. About 30 to 40% of patients with depression will have thoughts of suicide. Yeah.
If you're persistent, if you stick with it until you find the right treatment or the right combination, your odds of remission are very good. Be optimistic about a good outcome, and chances are very good that you'll have one.